7 deadly cancer signs in seniors you must never ignore. If you're over 60 or love someone who is, this video could literally save a life. Cancer doesn't always scream. Sometimes it whispers. And those whispers, most seniors miss them. Today, we'll uncover 7 silent but deadly cancer signs in seniors that far too many people ignore until it's too late. Stay with us till the end because early detection can mean the difference between life and death. 1. Bladder cancer. Ever notice blood in your urine even once? That's not just old age. That could be bladder cancer knocking. Men aged 50 to 80 are especially at risk. Warning signs: blood in urine, even if painless. Burning while urinating. Urgency with little output. Pelvic discomfort. Smokers, listen up. Half of all bladder cancer cases are tied to tobacco. If you're experiencing these symptoms, see a doctor. Don't delay. Lung cancer. Cough that won't quit. Or got worse recently? Don't brush it off. 80% of lung cancer patients are over 60. Watch for persistent or changing cough, chest pain when laughing or breathing, shortness of breath with small effort, fatigue or sudden weight loss. Even non-smokers are at risk from air pollution or past exposure to asbestos or radon. And yes, coughing up blood, even a little, is a major red flag. Low-dose CT scans save lives. Ask your doctor about screening if you're high risk. 3. Pancreatic cancer. Sudden weight loss or diabetes out of nowhere? These could be early whispers of pancreatic cancer. This sneaky killer often hides until it's too late. But here's what to look for. Key signs: new diabetes diagnosis in a senior, jaundice, yellowing skin or eyes, abdominal or back pain, clay-colored stool or dark urine, loss of appetite or changes in taste. Pancreatic cancer often hides behind common symptoms. If something feels off, don't ignore it. 4. Breast cancer. Ladies, even after 65, you're not out of the woods. In fact, the older you get, the more breast cancer becomes a threat. Be alert to new lumps in the breast or armpit, nipple changes or discharge, skin dimpling, redness or an orange peel look, pain or pulling sensation in the breast. Routine screenings don't stop at 65. Your body changes, but cancer doesn't care about your birthday. 5. Prostate cancer. Gentlemen, over 75, then prostate cancer is already on your radar, even if you don't know it. By age 80, many men have some cancerous cells in their prostate. What to watch for: frequent urination, especially at night, weak or interrupted flow, blood in urine or semen, pain in the lower back, pelvis, or thighs. A simple PSA blood test can catch it early, and in some cases, watchful waiting is safer than aggressive treatment. 6. Colorectal cancer. Think blood in your stool is just hemorrhoids. Think again. Colorectal cancer risk skyrockets after 50, and many seniors miss the early signs. Signs to notice: persistent constipation or diarrhea, narrow or ribbon-like stools, rectal bleeding or dark, tarry stools, feeling like your bowels aren't empty, unexplained weight loss or fatigue. A colonoscopy can save your life. Don't skip it just because you're too old. 7. Skin cancer. Years of sun add up, especially if sunscreen wasn't your thing back in the day. By 65, skin cancer is the most common cancer in older adults. Use the ABCDE rule for moles. A. Asymmetry. B. Borders, irregular. C. Color, multiple. D. Diameter, larger than 6 mm. E. Evolving shape or size. Also watch for non-healing sores, pearly or crusty bumps, itching or bleeding patches. Can't check your own back? Ask a loved one or doctor. Your skin tells stories, and sometimes it's screaming for help. Aging doesn't mean ignoring symptoms. Cancer doesn't wait, and neither should you. Hit that like button, subscribe.